This video will assist students in using the ProQuest nursing and medical databases. To begin, as with all databases from UNCP, you need to start at the library's homepage. And if you're not here, you can simply go to any UNCP page, click on Quick Links, and click Library, and it will bring you here. And from here, to get to our databases, you can click under Resources, and then click Databases, and it'll bring you to this page. We'll list our popular databases listed by subject, and also by title. And with any of our databases, what we suggest is you begin with a subject, looking under your subject-specific databases, and I am going to begin with nursing and medicine. Click here. You'll see a list of nursing related databases, and the one we're going into first is the Health and Medicine Medical Collection, and this is from ProQuest. There's another video about CINAHL. If you click that database, what will happen is you will see a login screen like this appear first. And this is simply your Canvas Brave Web username and password. Enter it, and then it should take you onto the databases. And notice here you have your basic keyword search. And also it will allow you in these ProQuest databases to change databases or to add additional databases. So you can click here, and then you can scroll through the list to add other databases. Several of the other databases we get from this ProQuest company you may want to add. I'm scrolling through them slowly. You see here is our health and medical collection. Right below it is also our healthcare administration. Depending on your topic, you may want to add that. And also see we have a nursing and allied health. You can add that one as well. We have some public health database here. You may want to add that as well. If you're dealing with some sociological aspect, you may want to add that. Just as up above we passed the psychology databases, you may want to add those depending on your topic. And those are the ProQuest databases. So here's a sports medicine. Again, depending on your topic. I'm just going to click on Use Selected Databases, and here I am. Now notice you have several different features above top. Usually it's basic keyword search. I'm going to do COVID-19. And notice it'll come up. Well, it also helps if I type it right. Correct? Typing still counts. COVID-19. And if I wanted to, I could add in another term. I'll add in children or child. You can use the asterisk. If I want to go ahead and start limiting down to peer-reviewed, I can put a check in this box. And notice this one also gives me a chance to look up my mesh terms. These are medical subject headings. So if I wanted to look those up, I could click here. And since let me type in COVID and see if there is nope. Let's see. I'm spelling corona wrong. Well, if you type like I do, that's why I do a keyword search, because your subjects have to be specific. Or again, I could view it and just click here. It brings them up 100 at a time. So I would go next 100, next 100. You see how so instead of wasting my time here, COVID-19 and child, click on search, and I should get results. I got almost 4,000 results. In this database, you'll get your subject. You'll get your article information, bits and pieces from the article. If I need scholarly peer-reviewed, I could click here. If I want to limit to peer-reviewed, click there. Notice I dropped it significantly. And notice a lot of these, my child is not coming up. Typically, what I tell students to do is I click on a title. I'm going to click on abstract and details. It's different in this database. Click on abstract and details. This will provide you with an abstract. You can see more. Also notice here are my subject headings. They are linked, so I could click on one of those. And you can see all this information here. Now, typically, I don't go very far down. If you wanted to, one of the aspects of this, see there is coronaviruses as well. I could click here on COVID-19, and that would bring up anything in this database that had that subject. Granted, I would have to go back through and relimit to peer-reviewed. And then I could use my subject terms here to limit it more down. If I'm looking at something like pneumonia or intensive care or ventilators. And these, as you may have noticed, they come up by number here. They're not in any kind of order. Well, there are in that kind of order, but down at the very, if I scroll down here, I can click on apply. And you see my filters that I've added. I'm down to 302. Now, some of these items will be full text. And again, you can click here to view that. Click here for PDF full text. Click here and it adds them to a temporary folder. There is a video about using ProQuest folders, and those are more permanent. But you can view that video, or you can click here and follow the instructions to set up more permanent. The great thing about ProQuest is when I mark these, and I'm just marking them helter-skelter here. When I go to email my items, I can tell it to include bibliography. Now notice, I don't know if they ProQuest has not added APA 7th yet. So you may want to take a look to be sure, but I think there is not much difference, if any, with articles. It's books that are mainly different. I can include my citations at the end, and I can send this. Bad news is if the file is too big, you'll just get links back. So be aware of that to the articles. And the great thing, you notice also that I've marked my items. You see my little quotations here that says cite them. Here they are cited in APA. That's good and bad news because I can tell in this one, some of these letters probably should be capitalized because this is the name of the system. Probably these should be capitalized. So you have to edit those. Any citations, you probably are, if you've seen the other video, you've heard me say this, verify, and verify. So please do that. I've come up with a new little acronym for a lot of my citations these days. It's called the CPR method, cut, paste, repair. So as medical students, you'll probably get my bad humor in that. But, I mean, that's what you have to do. Most of the databases, most of your scholarly sources will provide you with a citation. You can cut and paste. But don't forget the R. Don't forget to repair. It could also stand for reflect, revise. You need to do that. But you can copy and paste this into a Word document, or you can email that. However, And if I want to get rid of one of my filters, I can just exit off. You see that will change my results. If I want to get rid of the first one, pneumonia, I'm down to 120. And here's my date range, or I could go through and take a look at some of these other ones as well. Document type. Articles is pretty much what you're looking for. If you're looking for most of your peer-reviewed items will be articles. Commentary is probably not peer-reviewed. Your correspondence is not peer-reviewed, even though they are in a peer-reviewed journal. So there is a difference. I clicked here on article. It's updating. So here you have it. If you have any questions, please contact us. And if I go back to the library's homepage, we have several methods of contact. There's the Ask a Librarian link that provides you with the phone number for the reference desk, the email and an email blank. Here's our chat window if you want to chat with us. Also, we have added a WebEx for video chat. You can use that. Or if you want to, you can click under Contact Us and look for me. I'm down here. That's me. You see I have a face built for radio. So I'd like to say I'm the second bald dude on the first line. So please contact us. I'm sorry about my email popping in. So please contact us if you have any questions. Thank you. Have a good day.